This video is a very important one. It's talking really about safety in hair transplant surgery. So what does safety mean? It really means talking about future hair loss and whether you have enough hairs today to cover future hair loss. This is motivated by several problems that I've seen in the industry today. What I've seen is that people are now going to see business people, salespeople, that are making decisions of a clinical nature and that are only motivated by making money and not really about your safety. How do I know this? Well, I'll talk about two cases. One is a gentleman is a friend of mine. His brother was offered a huge session of a transplant. I said, send me the photos, let me take a look. He was a 30-year-old Norwood 6, which is very advanced hair loss with progressive miniaturization of his back donor area, and he was offered a ARTAS robot transplant on the East Coast. I said, there's no way. You're gonna have a burned out donor hair, the transplanted grafts will disappear, you're gonna have scars that are not fixable. And he said, well, thank you for saving the money on the transplant I would have had. I said, it's not the money that I saved you on the transplant, it's a future lifetime of misery. And that's what this video is about. Another case is a local Dallas chain that the person just met with business people, just salespeople with no doctors, was told he needed 4,500 grafts, 2,500 in the front, 2,000 in the back, 6 months later, FUE. No way. I saw him in person. He doesn't have the donor capacity for 4,500 grafts. There's no way that even exists in his scalp. So this is the insanity that's happening in our industry, is that clinical judgment is being made by non-medical doctors. Procedures are being performed by non-medical doctors, just people that are sales oriented. Now listen, I enjoy sales in the sense that I'm passionate about what I do. I think I offer great results, but the answer of no is so important as well. And I have a financial incentive to sell you a surgery, okay? I'm a surgeon, I'm a business person, I want to sell you surgery, right? We all do. Every single hair transplant outfit out there absolutely is motivated to sell you a surgery. The real problem with that is there's people out there that should not have it. So I did a video many years ago on the safety for young men, and there's no qualitative cutoff or quantitative cutoff where I say if you're under 25, under 30 years old, you should never have a hair transplant. But there are a lot of factors that come into my mind, how young you are. Why is that important? Because the younger you are, the more lifetime of hair loss you have, and it's a numbers game of supply and demand. If you have a finite number of hairs that I can transplant, and that supply continues to diminish and your demand increases, I may easily run out of supply to fix future demand, not just current demand, but future demand. And that is a huge issue, because what does that leave you with? It leaves you with a weird, let's say that I transplant you with permanent hair in the front and aggressively make a hairline that looks great for a couple of years. Then that hairline stays there and everything around it disappears. And then you've got this weird transplanted center that's almost impossible for me to fix. So that's a real problem. Let's take the flip side of that. Especially with FUE today, harvesting way up into these zones that are not safe. What does not safe mean? These are non-permanent hairs. If I move those hairs to the front and you lose those hairs, you'll have exposed white dot scars. You'll have a variable loss of the transplanted hairs in a patchy way that will become very weird. So, understand that the younger you are, the higher risk there is. And I'm not trying to scare you. It's a calculated risk. It's my ability to sit there and go, okay, the risk is too high, never have surgery. I'm going to tell you that. And I'm going to tell you that if I tell you not to have surgery, it's not because I'm stupid, I don't want to make money, and I don't want to have a business. It's because I'm looking out for your best interest. And today I have to state this because you are now having non-surgeons, non-physicians telling you, please have surgery. And what you don't understand is that $10,000, $20,000, whatever money you're spending on the surgery is not the problem. That's part of the problem. The real problem is draining your donor bank so that you don't have enough hair for future issues to cover future problems. The one thing is true is that young individuals in particular are oftentimes more desperate because they want to look like their peers. So long as I look good for 5 years, I get married, I'm happy, it's all good. We don't have, as human beings, we have a very limited capacity to think about how we would feel in 10 years from now. I'm 51 years old. I think 60 years old is older because I'm 50. But when I was 40, I thought 50 was old. When I was 30, I thought 40 was old. When I was in medical school in my 20s, I thought, hey, 35 is pretty old. My mom, who's 80, thinks 80 is pretty young. We don't care what we look like in 10 years. And so my biggest thing is I have to care on your behalf not to do surgery when I tell you you should not have surgery. I'm not telling you shouldn't have surgery because I just somehow don't want to run a business here. And that's the problem. I tell my young patients that are particularly dangerous, I look at them, I don't think you're gonna be safe in a few years. I tell them that not because I don't want to run a business, but because I want to keep them safe. And so the easiest thing is if you go get another consultation, someone's going to say yes, and that person's the least qualified to do your transplant. So I encourage you, especially if you're younger, progressive in hair loss, not to just go seek consultations, especially with salespeople. You're not meeting with a doctor. That can be really, really problematic in my opinion. You're gonna have problems in the future. Even if you don't care about those future problems, I have to care on your behalf. Now, am I perfect in my judgment? No. I look at what I do as green light, yellow light, and red light. Green light means, okay, this person's really safe. Who's that safe person? Person that's not that progressed or maybe older in age. Maybe it even need medical therapy. That person is on the very safe side. I have so much donor hair capacity to cover future issues. That's a serious green light. A yellow light means, you know what, he's younger. He's got to need medical therapy to help minimize progression. He needs to be compliant with that medical therapy. I've got to be more conservative with my transplant. I've got to be more careful in preserving donor capacity for future issues. That's when we're in that yellow zone, I'll counsel you. Here are your long-term risks. Here are your safety issues. And that's really what's important, having that discussion. And then there's that red category, which means never have a transplant. I know it's devastating for someone out there to hear that, but when I tell you a no, there's a real intent behind it. It's for your safety. As I told you, every practicing hair surgeon has a financial incentive to tell you yes. And if you ask enough questions, someone will tell you yes. But this is something where you're spending 10 times what you paid on the initial surgery to correct future problems. And you may not even be able to correct it. And using FUE, FUT, using scalp micropigmentation, a host of ways to manage it. And you still may not be able to look natural. And that's so important you hear me, that don't just go seek other consultations. If I tell you no, there's a real reason behind the no. A lot of people say, you know, what is part of a good detailed history? Is it really getting into your family history? You know, what's interesting is I'm probably one of the few surgeons out there that I don't even ask for family history. So, well, that's not really complete. You should ask, my father's balding, my mother's balding, who's balding in my family? This is what's interesting. If you're 60 years old, for example, and you have a certain amount of loss, and your whole family didn't bald, well, I know what you're balding because I look at you and I know your history, I know what's going on with your head. I don't care what your family's doing. If you're 30 years old and you're rapidly balding, and you said, my family history is fine. There's no one in my family that's losing hair. I can tell you, my uncles, my grandfather, my mother, my father, everyone, my brother, my sisters, none of them are losing hair, but I'm losing hair a lot. Well, oh, you know what? I should really ask about this family history. Okay, they're all safe. You know what? Let's go do an aggressive transplant for you. I don't care about what no, I have to see what's happening with your scalp. So family history to me is way overrated. I'm focused on what is happening for you. So there's nothing riskless or risk-free of hair surgery. But my goal is to keep you safe. So I'm hoping that even if you don't come to me in Dallas for surgery, it's not my motivation with this video, it's to keep people safe out there, because the industry today with hair is becoming incredibly depressing to me. I'm sad about it. I'm sad about it. It grieves my heart. I lose sleep over this because today it is now in the hands of a businessman. It's in the hands of someone that is a sales individual that just has motivated you. I just saw my patient that was in this local chain had like 6 texts from this guy. Okay, we're gonna give you a discount. Come in, get more grafts. Okay, that's nonsense, okay? Yes, it's a business. Yes, I have to feed my family with what I do, but safety is so critical. And you're not going to get a text from me asking you, why didn't you schedule with me? You don't want to schedule with me? Fine, don't schedule with me. But don't try to seek more consultations. If I give you a red light and tell you no, there's a serious reason why. I want to keep you safe for your future.